Welcome to the Center of Excellence in the University of Bridgeport. I am Dr. Robert Brody. I guess I should tell you a little bit about myself first. I attended Green Mountain College, which is an environmental liberal arts school for my undergraduate degree. From there, I went into the wide world of adventure recreation and whitewater kayaking. I was a professional whitewater kayak instructor traveling the country. I then, after one of the seasons was over, I moved up to Vermont and started working at a local high school as a teacher assistant up there in the special education. And that really opened my eye up back to medicine. My father is a homeopath and a nutritionalist, practicing for about 35 years in Pennsylvania. So it's always been kind of my roots. I just never thought I would go into it. So after this stint at the high school, I went into Temple University to go pre-med, because I had to go a full-year pre-med, and that was a very exciting time, the chemistries and organic chemistries and physics and all that fun stuff. I later attended the University of Bridgeport, College of Naturopathic Medicine here. I graduated with my doctorate degree in Naturopathic Medicine. I also graduated with a master's degree from the Human Nutrition Institute. From there, I did my residency in this very building, the Center of Excellence with Dr. Peter Diadamo. I'm one of many residents or people that have come with him and worked with him. I am currently the vice president of a fellowship society for naturopathic physicians called the Institute of Naturopathic Generative Medicine. I also, in case you guys haven't heard, I do medical missions in Guatemala. I'll bring different medical students down, nursing students, chiropractors, acupuncturists, naturopathic students down to Guatemala, do a rotation down there. It lasts about a week when we're down there, and we see the indigenous population there. I'm also a teacher assistant here at the University of Bridgeport in the College of Naturopathic Medicine. In this building, I'm also the senior shift supervisor, so that means I supervise all the students. Kind of follow the resident, make sure the resident's doing their job, make sure the students are doing their job, and make sure Dr. Diadamo and the other doctors are where they need to be. I'm also, yeah, exactly. Yeah, I do many different things. Tonight, this is fun. I always love presenting, so I just keep talking. And I'm the professional services manager at Diadamo Personalized Nutrition. So if you're a doctor or a healthcare professional and you have a question that's related to any sort of thing that has to do with medicine, you'll be talking to me at some point. Whew. All right. I already explained a little bit of my health history. That's my father. The other, where I got a lot of my drive from medicine, that's one of my kayaking events, me kayaking. That's why I shouldn't have did it there, though. So. This year, this practice, we got voted the best doctors in Connecticut as naturopathic doctors. That's Connecticut Magazine right there. You can pick it up. I forget what, was that May? It might be May's edition, so some might be in a couple of stores, but we're in there. While the other doctors, but we need to start from the beginning, and we need to know what naturopathic medicine is. Do you guys know what naturopathic medicine is? Yes? No? Maybe?
Not really.
Not really?
I have an idea, but...
So basically what it is, we're family doctors who are trained to use natural alternatives, natural medicine, so vitamins, minerals, herbs. And we always try to address the root cause of the problem. It's really, we go to medical school for 4 years, we were pre-med beforehand, we go through the process just like Corey is going through right now. And when you're done, you sit for your boards and you become licensed. And in the state of Connecticut, we're licensed as a specialist, so we're naturopathic physicians licensed as a specialist. All that kind of good training that comes with that, all the boards and whatnot. Naturopathic medicine is actually one of those medical fields where we actually have a philosophy to our medicine still. Allopathic physicians, which are medical doctors, nurses, and that kind of stuff, they have somewhat of a philosophy, but it's not rooted in themselves. And same thing with osteopathic doctors, it's not really rooted anymore. And one of the things that us naturopaths we love is that we're so rooted in our philosophy. And there are 6 points of our philosophy. I'm going to go over very briefly, so don't worry. The healing power of nature, the Naturopathia Naturae. My Latin is horrible today, excuse me. It pretty much means that we understand that the body has an innate ability to heal itself. Now that's a pretty profound statement right there. The body's going to heal itself. But if we take a step back and look at that and really kind of concentrate what that means, it actually makes a lot of sense. And I'll just go into when I was an undergrad at Green Mountain College, one of my friends who went to allopathic school and became a surgeon. And I was trying to explain this topic to her, and I had to just go back from an example because it's the easiest thing. So God forbid I'm out in the woods doing whatever I'm doing, hiking, playing with my dog, and I get cut. So I get cut, I'm going to go to the emergency room. I'm going to go there, they're going to clean it out, they're going to stitch it up, and they're going to put the skin back together. I'd be like, well, what's really healing? Is the doctor healing by sewing the skin back together? Or is it the doctor allowing the body to heal itself by putting the skin back together? Because by putting the skin back together, your vessels are able to connect, you're able to make cells, scar tissue, and your body can heal itself. So you're giving the body the tools that it needs to heal itself. And that's one of the things that us naturopathic doctors always try to hold dear to us. To cause them, treat the underlying cause. We don't want to suppress symptoms. Symptoms are usually there telling you that there's something going on with the body. A perfect example of this, of symptom management, is if you ever had a fever before. Now, most of the time, if you have a fever, they're going to tell you to take Tylenol to suppress that fever. Not necessarily the best thing. With that fever, the body's making that hotness to burn off any of the bugs, any of the bacteria that's going on. So by suppressing that process, you're actually hurting the body or hindering the body from healing itself. So, there's a point when, the fever gets too high and you need to suppress it because it's a life and death situation. That's usually kind of above 104 degrees for most people. When it gets up to 104 above, then yeah, that's when drastic measures need to be taken, but everything's kind of an incremental approach. Just like my allopathic and osteopathic colleagues, so my medical doctors and osteopathic doctors, anyone in those fields, we have this concept of first do no harm. So in naturopathic medicine, we like to look at that from the least invasive procedures to the most invasive procedures. So I'll have patients that come in and I'll tell them, no, you need to go get chemotherapy right now because you're a blood type A, you have 7 whorls, you have a family history of breast cancer, you have breast cancer, you need to get chemotherapy, and I'm going to make sure that the chemotherapy is effective and not no side effects from it, and we're going to get through it, no problem. Then I'll have other patients that be like, no, actually you do not need that. Let's do this natural approach, we'll do diet, lifestyle, supplements, vitamins, minerals, etc. You'll be fine. But it always should be a gradual process. Always should be using the least invasive stuff first, so not using surgery first, and use the least invasive stuff first. It's kind of a delicate balance for sure. And to my, I have a lot of medical colleagues and medical friends, and they only can really do 3 things. They can prescribe drugs, they can do physical therapy, and they can do surgery. And if it's not one of those things, then they're out of luck. They don't know what to do. Doctor as teacher, that's what I'm doing now, trying to explain a little bit what I do, kind of be a little bit animated. Also, like when I have a patient at the end of the visit, I explain everything that I'm doing. I explain why I'm using this. I'm explaining what this is going to do, the dosage, my thought process of what disease, why it's happening, all that good information. I also give you a little kind of flow chart, so if you do have a medical doctor, a family doctor, you can take this to them and they'll understand oh, I'm using, you have diabetes and I'm affecting the AMPK gene, and I'm affecting that with this certain herb for the diabetes. And they'll be like, oh, well that makes sense. You should continue doing that. And it's always good just the integrative care in that aspect. So there's a lot of people, we get people who are completely allopathic, that's all they do, family medicine, that's all they do, and then we get the people who are just completely naturopathic, holistic, and that's all they do, and then we get most of the people who are in the middle, who need a balancing act at both times. And that's really, I work with that population and this population, it's really how it goes. Treat the whole person, this is holistic medicine, we're treating everything, we understand there's a mind-body connection, that everything's working together. I always go back to quantum physics and that kind of stuff, or Einstein who said, energy can't be created nor destroyed. It's being transferred somehow. And understanding that process, and I did a talk with the students a little bit ago at their philosophy day, and I said I don't care how they get better, as long as the patient gets better. I don't care what it does, or I'm not going to say oh, someone tells you to go outside and sit in a tub full of grape juice with leeches on your arm, sing the Macarena at the full moon. If that's working for them, and it's not hurting them, and they're getting better, I'm completely fine with that. So people are like, whoa, what? I'm taking ego out of medicine. I don't want to have ego in medicine because it's about the patient. The patient is the king, the queen, the person that knows their body the best. I'm just a wise advisor telling them to help them go down the path of health and wellness. And the last little point, and there'll be less talking from this point of view afterwards, prevention, preventative medicine, but true preventative medicine. So there's a difference between preventative medicine and true preventative medicine. So in the allopathic world, preventative medicine is early detection. You have a mammogram, go get your mammogram, because if you have something, we're going to catch it. Or you're going to get your prostate exam. If you have something, we're going to catch it. That's early detection, that's not prevention. So that's one of the areas where blood type and all this genetic information comes in handy, because if you have this gene, if you have this blood type, you're going to be more predisposed to certain diseases, especially if you've had a history and this and that, and we can work to prevent things like that. Family history of Alzheimer's, you have more than ulnar loops in your fingers and your blood type O, and you can't smell peanut butter anymore, we got to worry about Alzheimer's disease. And there's a lot of cool research about that out there right now. That doesn't mean I'm not going to tell someone, like, don't go get your mammogram, don't go get your colonoscopy. It's just taking all that information and using it as an individualized approach to people, to medicine. Because we're all unique, you know, we're all different people.